Hello friends, I am Arati Kadam. My topic of discussion is opioid analysis. Opioid analysis are the drugs which act on opioid receptor. Opioid receptor are three types: mu receptor, kappa receptor, delta receptor. Mu receptors, there are two subtypes: mu1, mu2. Higher affinity of mu receptor has been detected in periaqueductal gray, thalamus, spinal cord, substantia gelatinosa. Action of mu receptor: mu1 dependence, morphine type, analgesia, supraspinal; mu2 respiratory depression, sedation, muosis, decreased GI motility, muscular rigidity. Kappa receptor subtypes: kappa 1, kappa 2, kappa 3. Location of kappa receptor: hypothalamus, periaqueductal gray, claustrum, spinal cord, substantia gelatinosa. Action of kappa receptor: analgesia, spinal K1, supraspinal K2, respiratory depression, dysphoria, psychotomimetic effect, dependence, nalorphine type, reduced GI motility, sedation. Delta receptor location: brain, pontine nuclei, olfactory bulb, deep cortex. Action: analgesia, spinal plus affective component of supraspinal, respiratory depression, affective behavior, proconvulsion, physical dependence, reduced GI motility. Let's see how the opioids acts on opioid receptor and how the mechanism of action of opioid receptor take place. When opioids binds on opioid receptor, which are G protein coupled receptor, opioid receptor activation take place, then inhibits adenyl cyclase and decrease intracellular cyclic AMP, which promote opening of potassium channel and inhibit opening of calcium channel, result in neuronal hyperpolarization and reduce availability of intracellular calcium. Decrease neurotransmitter release from primary nociceptive afferent, which relieve pain. Let's see the picture of mechanism of action of opioids on opioid receptor. Complex action opioids. Complex action opioids means opioids acts as agonist on one receptor and antagonist on another receptor. Classification of complex action opioids categorized into two categories. First, agonist antagonist. Second, partial agonist and antagonist. Let's see the drugs included in agonist antagonist category: nalorphine, pentazocine, butorphanol, nalbuphine. And drug included in partial agonist antagonist: buprenorphine. Nalorphine is N-allyl normorphine. It is first antagonist, later found have agonist action, clinically not used because of this dysphoric and psychotomimetic effect. Pentazocine, used as analgesic, acts agonist at kappa receptor and weak antagonist at mu receptor. In low doses, its pharmacological action similar to morphine. Uses: analgesia, respiratory depression. Actions of pentazocine: analgesia, respiratory depression, physical and psychological dependence, nausea, vomiting, constipation, biliary spasm. Pharmacokinetics of pentazocine: effective orally, oral parental ratio 1:3, plasma half-life 3 to 4 hours. Side effects: sedation, nausea, vomiting, respiratory depression, nightmare, tachycardia, palpitation, rise in BP at high doses occur. Uses: postoperative and moderate severe pain in burns, trauma, fracture, cancer. Butorphanol, stronger and more potent than pentazocine. Dose of butorphanol of 2 mg is equal to pentazocine of 30 mg. Nalbuphine, structural analog of naloxone, more potent analgesic than pentazocine. Side effect: produce few dysphoric and psychotomimetic effect. Buprenorphine, synthetic thibin congener, 25 times more potent than morphine. Action similar to that of morphine, like analgesia, respiratory depression, physical and dependence, less than morphine. hypotension, nausea, vomiting, euphoria, constipation, sedation. Pharmacokinetics of buprenorphine. Good efficacy by sublingual route, onset of action slower and duration is longer. Uses of buprenorphine. For longer lasting painful condition, example cancer, post-operative pain, in treatment of morphine dependence as alternative to methadone. Pure opioid antagonist. These are naloxone, naltrexone, nalmefene. In normal individual, opioid antagonists do not produce any effect. Naloxone. Let's see the first drug which antagonists are naloxone. Uses drug of choice for morphine and other opioid poisoning, or reverse respiratory depression due to intraoperative use of opioids. Ineffective orally given by IV route. Naltrexone. Orally more potent and has longer duration of action than naloxone. Uses of naltrexone to prevent relapse in opioid dependent individual. Side effect: nausea, headache, hepatotoxicity. Endogenous opioid peptide. Endogenous opioid peptides means which substance occur naturally in human brain, pituitary and peripheral tissue, which action like morphine. These are called endogenous opioid peptide. Drug included in endogenous opioid peptides: endormif, enkephalin, dynorphins. Now we discuss MCQ. Question number 1. Which type of opioid receptor primarily mediates analgesic effect of opioids? Option: first, mu, second, delta, C, kappa, D, sigma. Answer is mu. Question number 2. Which opioid receptor subtype is associated with dysphoric and psychotomimetic effect? Option: A, mu, B, delta, C, kappa, D, sigma. Answer is kappa. Question number 3. Which opioid antagonist is used for long-term treatment of opioid dependency? Option: A, naloxone, B, naltrexone, C, methadone, D, fentanyl. Answer is naltrexone. Question number 4. What is the main purpose of naltrexone in opioid addiction treatment? Option is A, opioid detoxification, B, opioid overdose reversal, option C, opioid receptor blockade, option D, opioid receptor activation. Answer is opioid receptor blockade. Question number 5. One of the side effects of chronic opioids is option A, hypertension, B, hypoglycemia, C, opioid tolerance, D, increased GI motility. Answer is opioid tolerance. Thank you.